Hi, everybody. Welcome to our 7th video in our self-care community experience. I am so excited to be here tonight with Dr. Shanique Ampiah. We have so many questions for her all about the theme of mental health. But before I introduce her formally and get into our topic, I want to tell you who I am if we have never met before. I am Kelly Youngs, the founder of She Is Fierce. We are a global women's organization for professionals and entrepreneurs. We have women of all ages, all stripes, and all over the world. But we are based right here in North Florida and proud to be partnering with Baptist to create the self-care experience and to bring you these videos each week. So, first of all, I know that the fabulous Jean, who is here with us that you can't see, is going to share the link where you can actually download a beautiful fillable workbook and take this self-care experience on your own time, follow along with us this week and next week, and be a part of our community of hundreds and hundreds of women who have signed up to be a part of this experience. And tonight, I am so excited to talk to Dr. Shanique Ampiah about a theme that I think every single one of us is keenly interested in 2020 more than ever, right? So tonight we're going to talk a lot about mental health, what that means for women, how we can both embrace and pursue mental health, but also the kind of bigger picture of what it looks like for women in general, and then what it looks like for, we just talked about before we came on, moms of young children, moms of teenagers, people who are working, maybe from home, maybe homeschooling at the same time. We've all got a lot going on. And the last thing I think on many of our minds is how are we protecting our mental health? So before we jump in, Dr. Ampiah, can I brag a little bit about you and then ask you to share a little bit more about yourself and what you do at Baptist? So
Sure.
I have your fabulous bio here. Dr. Ampiah is a fellowship trained and board certified psychiatrist who believes in the power of early intervention and the ability to change the trajectory of psychiatric illness. So I love this concept of being able to change, of stepping in. That is absolutely what we're doing at She Is Fierce, whether it's on a professional level or a wellness level. And it is 100% what this self-care experience is about. So can you tell us what that actually means in real life and what you do for Baptist and with your clients?
So my name is Dr. Shanique Ampiah, and thank you so much, Kelly, for having me. I'm so excited to be able to just join the conversation and normalize conversations about mental illness because it's so, so important. I am double board certified both in adult and child and adolescent psychiatry. At Baptist, my primary role is in child and adolescent psychiatry, so I get to work with my babies. I love it. I call them my kiddos. And that's my goal, really, is if I can make a change to one child's life, then that child becomes an adult who knows adaptive coping skills, and they go on to have a generation. And so then I think that I've changed a generation from just one person. So it's intervening early to initiate change. Again, very, very excited to have this conversation. So can't wait to get into it.
Okay, so first of all, I've always been excited about this conversation, but you're already getting me excited. Talking about the themes of generational change and stepping in and helping people, which I know, just within my own friend circle, I have had this conversation about the need to kind of stop things and to make positive change, whether it's for your children or for yourself. So first of all, can you talk to us about the rates of mental illness in women, what that actually looks like? I feel a little bit like that's a statistic that we don't ever talk about, but it's something that is really important because women are holding up our society.
Play many roles, right?
Yeah.
So just in terms of just talking about mental health as a go to start off with, really, mental health is an integral component of our overall well-being, right? So we know that we have that as our backdrop. And then unfortunately, it's often also neglected, meaning that the majority of people who have mental health problems don't seek help. And we know that's due to stigma. It's due to there not being enough mental health resources, not enough psychiatrists, not enough social workers, therapists, et cetera. And so we have that already dirt that's there with just the lack of resource. Then when you look at the most common mental illnesses, depression and anxiety, we see that one, depression is one of the leading causes of morbidity and mortality globally. So around 300 million people around the globe have depression, and that ends up leading to shorter lifespan because of suicide completion and not being able to work because of depression, etc. So we've got those two as our most common. When you look further in terms of depression and anxiety, and as it relates to women, women are 2 to 3 times more likely than men to be diagnosed with depression and anxiety. So just that alone is really quite striking, and why we need to have conversations like this so that we know when we need help, how to reach out and how to get that help, because it's very, very prevalent, very common, and more common in women. Other types of mental health problems that we have to address as well is PTSD. Because women are more prone to being victims of violence, there is a higher rate of PTSD in women too. And for substance abuse, men are still more prevalent in their use of substance, but the rates are increasing. And we know, again, that because a lot of people don't actually seek help, even though we have all these fancy numbers, the numbers in reality are actually higher.
Yeah, I mean, I'm sure the numbers are significantly higher, right? Because as you already said, we know that many people don't talk about it, even when they're aware of it.
Right.
To be honest, I work with women obviously every single day. I knew that the rates were higher, but I had no idea the statistics were so much greater for women. So that's a little bit depressing about depression. But can you tell us, what's the impact of COVID-19, of everything that's going on? I mean, I feel like so many conversations I've been having, like everyone else, are around things that are holding people back, right? So whether that's illness or fear of illness or all the other factors, how is that playing into women's lives right now as you're seeing it?
I think it's really important. It's interesting because normally, as a psychiatrist, if someone tells me that they're isolating, so they don't want to go out, they don't want to interact with other people, they're really concerned about getting sick, so they don't want to be around others, then I would say, are we depressed, or do we have what used to be called hypochondriasis or illness anxiety disorder? But in COVID, living in a pandemic, that's sort of the norm that we've had to accommodate or adjust to. So we don't fully know the longitudinal impact yet in terms of how COVID has affected mental health, but we can certainly take a guess. There's been increases in the rate of reports of depression and anxiety across both genders. And so we know that because women are more likely, of course, there's an increase in that rate as well. Recently, I think actually it was in June, when the Journal of the American Medical Association published that looking back over the last 2 years, there's been a 4 times increase in the rate of people reporting psychological distress. So that's echoing that the rates are increasing. COVID is not making that any better. And for our talk tonight, I think it's really, really very, very important that we are aware of what is COVID adjustment versus major depressive disorder, anxiety disorder, realizing that these are going to be more persistent and associated with impairments as well. So we're all disrupted. COVID is disruptive. This is really, really hard for everyone to manage. But when it starts becoming where someone is chronically sad, irritable, lonely, and hedonic, and also chronically fearful, anxious, then we worry about it going into meeting criteria for a mental disorder.
So, okay. So there's a lot to unpack in that.
Sure.
What I always think about when we do these videos is who is actually watching this, right? So we know that we have thousands of women over the course of the coming week that will be watching this video. Mm-hmm. And we have some people who are feeling pretty good about their mental health and they're thinking, I'm just coming here for tips and tricks. And we will have people who are really struggling and, are kind of in that place that you're talking about. Mm-hmm. So, of course, if they're in that place, I know your advice is going to be go to Baptist, see an expert wherever you are.
Yeah.
Right. But if we're talking to somebody who is watching and is like, I'm struggling, I'm down, I don't feel depressed necessarily, but I'm struggling, right? COVID, being isolated, maybe they're under additional pressure, financial, health-wise, whatever. Mm-hmm. What does it actually mean? I know we hear this a lot, and I love the idea that we're talking about this, but what does it actually mean to guard your mental health?
Great question. So we think a lot about physical ailments, right? Like if you've got a stomach ache, you can point to it, you can touch it, you can feel it, you can show your physician. With mental illness, it's not the same. you can't necessarily touch it. It's not as tangible. Certainly, people can guess from how people are acting that maybe they're depressed, but really, the individual who's experiencing it is going to be the best judge of how they really feel, right? So the way that I think about guarding your mental health is to put on your own oxygen mask first. If you've ever flown, you'll hear the flight attendant say, put on your seatbelt, and then if there's a change in cabin pressure, oxygen mask will fall, put yours on first before you secure someone else's. And that's because once the pressures change, you're going to pass out. And we can't help anyone if we're incapacitated or we're unable to help ourselves. So that's really what I think about when I think of guarding your mental health, is putting yourself in a place where you're checking in and you're knowing how you're feeling and being vulnerable enough, realizing it's not a weakness to seek help when it's needed.
Yeah. Okay. So, first of all, I'm grateful to you for saying that, because I think we have, especially within the She Is Fierce community, and of course in our broader North Florida community, we have a lot of strong women, right? And a lot of women that are doing all the things. They're the backbone of their family. They're the backbone of their business or in their job. And I think a lot of us, we take pride in that. We take pride in the fact that we're doing everything and we're helping everybody else. So I love, and I have used that analogy many times myself around anything. It really works for anything, right? If you are not fully, at your best level, you can't be your best for someone else. So I'm grateful to you for sharing that as well.
Sure.
So now let's talk about the practical stuff. So there's a lot going on. Everybody's talking. We're only a few weeks away from Christmas. Everybody is under pressure from all sides, right? Come together with your family, travel across the country, don't do it, wear a mask, don't wear a mask. Everybody is dealing with whatever their own version is based on their family, their social situation. And every person who has an opinion thinks they're right, right? So how do we, as human beings who are also trying to just get through our days, how do we approach that? And what do you recommend for, guarding your mental health, but also, guarding your mental health while attempting to guard your physical health as well?
Right. Great question. And so, yes, women play many, many roles. And speaking to the community of She's Fierce and being a mom, being a wife, being a daughter, it's many hats. And if we're not careful and if we don't do self-check-ins, we realize that we don't have anywhere on our own plate. So I say that's the first step, is checking in with yourself. What's on your plate? Like literally do an exercise where you draw a circle, partition it, if you want to make it a pizza, however you want to do it, and then you allocate what your priorities are and where you are on that. Like, do you have time for yourself? Because again, that's part of that mentality of securing your own oxygen mask first. And so that's number one, getting back to basics. Are we breathing? Are we sleeping? Are we eating? The fundamental needs to keep us alive, right? Ensuring that there's some sort of structure. Like, yes, these days, perhaps we don't wear shoes anymore because we're working from home, or we don't wear pants anymore because we're working from home. But it doesn't mean that we can't keep
I do have pants on. I just want everyone to know that.
I'm wearing a dress. I think I'm safe. But I mean, really, you've seen it on the news, of, especially when we first went virtual, where people were having meetings like this, and then across runs, the partner or the kiddo, and it's just like, yeah, just ignore what's back there.
That's not happening.
So making sure that there's structure. So even though there's been so much disruption in our lives, keeping a sense of balance and routine can be very, very helpful for keeping everything else in place and in balance. And also not being afraid to delegate. It's not weakness to ask for help. You're not a bad mom if one night you have to get dinner from Publix. Like, it's okay.
Yeah.
We're all in this together. We're all struggling and we're all trying to make the best of it. I think it's also really, really important that we practice guarding our mental health by guarding our gates as well. So being mindful of what we're letting in. It's okay to unplug. We know what's going on in the news. It's traumatic. It's horrendous. But sometimes in order to guard our mental health, we sort of have to step back from that and put something else in instead. I think it's also very, very important to avoid vices, because now we are all struggling. It's very, very easy to develop maladaptive traits. And so being mindful and choosing to do things that are healthier for us, exercise, getting adequate sleep, etc. being also purposeful in our interactions. Now we are socially isolated. We're not able to see each other as we often would. And I think one thing for me that COVID has really taught me is to value the things that we took for granted. Really, like I can't just go up and hug my grandparents anymore without thinking like, wait a minute, I'm in the hospital. Okay, my kiddos are in school. I don't have any symptoms, but I have to be safe. So really valuing those interactions and making them meaningful, and realizing that we can stay connected even if we're not physically together. We've got Zoom, we've got platforms like this, which is very important. And last but not least, being optimistic. This too is going to pass. Vaccines are on the horizon. So if it's something where we can utilize this time to come out stronger, then it will be worth it. Like, I am not at all minimizing the grief that we're facing as well, but trying to find the rainbow or the light at the end of the tunnel, I think, is something that helps to build resilience in us and will posit us on a path of getting better. So those would be my tips.
Yeah, I love that. And so I want to say we have some great comments in here. So first of all, welcome, and thank you to everyone who is watching us. And, we're talking about a lot. Some of these things seem simple, but one of the things, we're in the 7th week of this, right? And so one of the themes that has come out throughout this experience has been the need to plan, the need to simplify, the need to kind of say, whatever you are dealing with, whatever which look, I am a mom of 2 young children. I'm running a business. I am employing people. I have a lot going on myself. So I understand and empathize with every single person who says I'm overwhelmed, right? I have 100% been there probably yesterday. And yet the tools to guard your mental health, like you were talking about, are so much ingrained in just being a planner, which is not, to be honest, for me, that's not my natural talent. And that's something that over the course of the last 7 weeks, as we've been going through this community experience, has been a real theme of just knowing, as you said earlier, what are you doing for yourself? Are you sleeping enough? Are you eating well? Are you taking a little bit of time for your physical health every day? And then also, and I would love to talk a little bit more about this, how are we making sure that we're guarding our relationships, right? So making sure that whether it is telling your grandparents, I can't come and see you, or whether it is you're stuck at home with your partner and you love them, but they're driving you crazy and you don't know quite how to handle that. What are your tips for, and I'm sure you've had this, many people, I imagine, come in your office and say, I can't take it anymore, right? What are your, kind of go-to strategies for handling those situations?
So again, remembering that we're all in this together. Like, we are all, especially before the restrictions lifted, we were all going a little bit cabin crazy because this was a huge adjustment for everyone. And so even though your loved one means the best, you can only tolerate leaving the hat or something where you don't want it to be left, or doing something that is really on a normal day that was not when we were all trying to get through a pandemic. You could kind of let that slide a little bit. Now it's like, okay, this is it, I can't do this anymore. So I think really stopping, taking a breath, being introspective, realizing that we're not the only ones that are going through this. We're all going through this together, and acknowledging how different people may show stress differently. So we know that this all comes into play with our thoughts, which then affect our feelings and which then affect our behavior. So CBT is what I've just described, cognitive behavioral therapy, like one of the landmark psychotherapeutic interventions. Thoughts affect feelings, behavior. So everyone is stressed. It's how we then acknowledge that you're not doing this by yourself. I'm here too, validating that person's feelings and giving them grace. I think that's the most important thing, is giving grace and being receptive to grace yourself.
Yeah. So I have to say, one of the best things in my mind that has come out of 2020 is this theme of giving grace, right? So we all know we're supposed to do that. We all think we're supposed to do it. And yet day to day we struggle because we think, well, I would have done that better, or they should prioritize me more, or whatever that thing is, right? And the idea of giving grace, we even talk about this in our actual download, our self-care download. And I know, and I'm sure that you're talking about this every single day in your practice, but the idea of giving grace to others, whether it's your colleague, your boss, your employee, your partner that's driving you crazy, or, you and I are both moms of young children, your children, right? Knowing that their world is different and shifting, and they're adapting as well. And I think a lot of times we want our kind of immediate situation to remain the same if everything around us is changing. And we have to give grace to others to say, I understand that you're dealing with this too, right?
Right. And that your expression of that stress might be different from how I would express, but it doesn't mean that you're wrong and I'm right. I think that's where the grace part also comes in. And I think definitely for kiddos, we sometimes forget, like, a lot of this has been adult strains, right? Like, a lot of people are out of work, relationships are strained, it's stressful because we have now gone from mom, employee in one domain to now teachers. Never valued teachers as much until we have had to do it ourselves. Like, we've always heard, and of course teachers are very, very important, but it's doing it yourself. It's like, oh, okay, it's a whole nother level when it's for you.
Yeah. Okay, so how do you recommend, as we talked about before, so there are situations where we're trying to deal with Christmas and we have to call our family and say we're not coming, or we are coming but under these restrictions or whatever. But also, like you're kind of alluding to with children, we want to give them grace, but we also have to kind of explain. And I know my kids are old enough they're young, but they're old enough to understand things are different. I'm not experiencing the same sports. I'm not able to see the same friends. My son turned 9 and we didn't have a big birthday party and he was sad. These are real things that every other mom out there is dealing with. So what are your recommendations just for communicating that and kind of maybe taking a little bit of the pain away and maybe adding a little bit of hope for children?
I think remembering that as parents, as caregivers, our role is to be present and consistent. And so being present means that you have your own oxygen mask on first, because children are looking to us no matter the age. Of course, as they get into adolescence, young adulthood, of course, they have adopted different skills to help them to guard their own mental health, so to speak. But they're still looking at us to know how to respond. And so we've got to be together. And also being able to be honest and say, this is really hard for mommy too. This is really hard because we can't do things. I would love to be able to have your normal birthday. I love seeing you so happy. And I know this is really, really hard, but we're trying to be healthy because there's this germ going around, and explaining it in a way that's developmentally appropriate to like your child's level, and validating their feelings that this is really, really hard and that we are missing out on things. But then in that same time, reassuring them that as mom, your job is to keep them safe, and you're doing everything in your power to make sure that that continues to happen. And so being in that position of, I am parent, I want you to still be a kiddo. So yes, we may not be able to have a slumber party right now, but maybe a Zoom party where you're still doing fun things as a child and letting mom be the caregiver, be the responsible one, so to speak, be the adult. And then I think also embedding routines and structures, similar things that you're using to guard your own mental health, into your child as well, and having conversations like this that say, okay, are you okay? In their word, they'll be able to tell you. In kiddos, and everyone really, asking open-ended questions and listening will get you the best answers. So really doing all of that, listening, being present, is my best advice.
Yeah. So that's wonderful advice. And I know I have both done that well and failed at that, right? At different times in the past. Your kids are still a little bit younger than mine, but are there any examples from your life or people that you know that you can share about maybe tactics that they've used, or just, how they overcame a challenge, right? Because sometimes maybe everyone else is better than me, but sometimes I start off in the wrong way and then I have to kind of take a step back and say, okay, let me adjust my approach to try to do better. Have you had that yourself, or have you seen that with others that you're friends with or in your practice?
So as a child psychiatrist, I am constantly doling out parenting advice, right? And I've gone through years of training to say this is what you should do. But in the moment, it's really, really hard because we are human. As moms, we also wear other hats, wear different hats. And so again, really guarding your mental health, being present, realizing when you've gotten to that place of, okay, I think I do need to take a break. If you have a partner, being able to tap out, like, okay, this tantrum is going on a little bit longer than I anticipated that it would. And it's not that kiddo is bad or anything like that. I don't believe that children are bad. They don't have the lexicon that adults do. Even some adults don't have the language to articulate how they feel. So we can't expect that. Right. So we can't expect that from children either, but realizing that everyone is struggling, realizing to be able to regulate your affects, being honest with yourself, like, okay, I'm not able to do this conversation right now, so mommy needs a little time out, and going, taking some breaths, centering yourself, and then coming back. Because what you don't want to showcase to a child is that as the adult, you don't know how to regulate your affects. Because if you don't, then how would you expect them to? So really remembering that as parents, you're supposed to be bigger, stronger, wiser, and kind. Bigger as the adult, stronger, being able to manage stresses that child can't, wiser as the adult, you've been alive longer, of course, and kind, coming from a place of nurturing.
I feel like we all need a poster that says that.
It's
Do you have one of those? Is that a thing?
It's circle of security. It's an attachment-based theory, therapy intervention. And so really, like, it's a circle, and it talks about how as children grow up, you want to be bigger, stronger, wiser, kind, let them go out and explore, but still be present. And then when they're coming in, celebrate with them and accept them when they're coming back in. So it's just maintaining that cycle. And again, it's a lot harder said than done in some ways, but I think as long as you are honest with yourself and, again, putting on your own oxygen mask, I think it's like the theme here, because once you're doing that, then you'll know, okay, I am in a place to have this conversation, or I'm really not. And the last thing, of course, that you want to do is to have your child see you in something that you wouldn't want them to emulate.
Yeah. I have to admit that anytime my children have ever done anything wrong, or like, something where I thought, oh gosh, they shouldn't have said that or done that, I think, oh my gosh, they got that from me, right? Hopefully not too bad. It hasn't been too bad. But I that is 100% true. I think that we forget that their behavior is a direct correlation to how we behave, right?
Absolutely. Absolutely.
Yeah. Okay. So I love that. Now I want to talk about something that's a little bit more serious, because, we kind of touched on this a little bit earlier, but we have women in all different situations that are going to be watching this, that are a part of our challenge. We have some people who are like, my marriage is getting better throughout this experience. And we have some people who unfortunately are going to be living in either, verbally abusive or even physically abusive situations. I know, and I've shared this many times with our She Is Fierce community, that I have been shocked, really, that we've had so many just phenomenal speakers. So if you're watching this and you don't know much about She Is Fierce, one of the things that we are known for, that I'm so proud of, is that we have amazing women that come and speak on our stage at our events and share their story. So they don't always try to teach you something. They don't always try to, motivate you. They just share their story. And a lot of times they're like Olympians and veterans and Emmy Award winners. And, they're just like at the top of their game. And yet, honestly, like statistically, a huge percentage have gotten up there and talked about being in physically or emotionally abusive relationships. And that really has been shocking for me, the number, right? And especially when you think about people who all of us look at and think like they've got it all together, they're super successful, they're talented, they're beautiful, they're smart, everything's easy for them. And the reality is that even people who we think are on a pedestal might be in that situation. So we all know somebody who's dealing with it now or has been. What is going on, first of all? And then, what do you advise women who are not only living in that situation, but living in it in an even more restrictive kind of world right now? What is your advice to somebody who might be watching this and is like, I just don't know what to do?
So as a scientific community, and I will always speak from being a scientist, but I'm also going to speak from being a woman, being a mom, understanding that that's challenging, right? When COVID happened and all the restrictions started, the scientific community was very, very concerned, because we thought, not working, home in a strained relationship, no one can leave, no financial independence, not a good combination. We anticipated that the rates of interpersonal violence or domestic violence, child abuse would skyrocket. And we actually have not found that. And that's interesting, right? But unfortunately, it's because the places that would serve as that catchment, so battered women don't often come out and say, hi, I'm being battered. It's usually that physician that's watching her body language and realizing something isn't right, or that friend that's saying, hey, what's going on, like really talk to me.
Yeah.
And so we don't have those interactions as much anymore. So we've got restrictions in place. So that catchment isn't there. Similarly, for children, it's the teachers saying, hey, what's going on, reaching in, reaching out, so to speak, and being able to do the report. So that's why the numbers haven't actually have not been reflected in the data that it's been increased. Doesn't mean that it's not happening. And so what I say to that woman is, first of all, get rid of ants. That sounds completely like, what do you? My mother is a licensed mental health therapist. And in many of her conversations, whether it's solicited or unsolicited, because she's mom, she tells me little nuggets of wisdom. And one of the ones that, as I was having an existential crisis, as I do sometimes because I'm human and it's hard to juggle all these hats, she's like, girl, get rid of those ants. And I'm like, Mommy, what are you talking about, ants? And she broke it down, automatic negative thoughts. And I'm like, are you really going to give me therapy right now? But it's very, very true. Automatic negative thoughts are those thoughts that we first have whenever we're thinking about something. So a teacher calls on you when you're back in school days and you think, oh, I'm in trouble. You got defensive. You changed the way you behave, etc. Similarly, women in battered relationships, you're used to being told you're not enough. You deserve this. You're not worthy. You're not going to be able to get anyone to treat you or love you or take care of you like I do, which is not true. If you examine the evidence, those are all ants, automatic negative thoughts type. If you parallels, not exactly the same, but the analogy here is that we know that ants, although very, very minuscule, can be very powerful when they come together and can devour something that's 10 times their size easily. And so those automatic negative thoughts, that mindset of a battered woman or a woman in a strained relationship, that things can't get better, that they can't seek help, that can be crippling and keep them in that situation. So first, getting rid of those ants, realizing that that's not true. You are worth it. You do deserve more, and it is not your fault. It is never your fault to be in a situation where you're not safe or your children are not safe. And reaching in, digging deep, finding that power, whatever that last little nugget of strength is, to pull through and reach out and seek help. Vulnerability is not weakness. And so really that would be my advice, is realize that these are ants, squash them, get rid of them, and reach out and get help.
And so just on a practical level, do you recommend that people call, I mean, obviously I know an ideal situation is call the shelter, have them come and help you, but, not to get into all the detail, but I know, some people's phones are being tracked, right? So how do you recommend that somebody who is just like, I know I've kind of gotten past that, I've listened to you, I've gotten past the automatic negative thoughts, I know I need to get out of this situation. Is it call a friend? Is it, somehow physically get yourself somewhere? Like, what is the first step?
I think the first step is making the decision that you're not going to tolerate it anymore. And then once you've done that, all the other options become easy. There's a concept in psychology called learned helplessness, where basically someone has, or the study has been with dogs, put the dogs in a cage, you electrocute the gates, the dogs start to leave, they get electrocuted each time. Eventually, even though the electricity is off, the dogs no longer try to leave. So once you have faced those ants, you have made the decision that you are no longer going to tolerate this, then it becomes a lot easier to pick up the phone, or to, if you're not feeling well and you're actually in a place where you can talk to someone and reach out and get help. I know that there are many different text lines, like here in Jacksonville, we have the Hubbard House. I can share that number later for you, 911, just whatever it is that's going to call attention that things are not okay. And taking that step is really the most important. And that's the best advice that I can think of in this moment to give. And I know it's hard, but again, once you've made that decision.
All right. So I want to say, Julia's saying she loves that automatic negative thoughts. I love that as well. I know we were talking about it in the context of probably one of the worst possible situations, but I think that also applies across the board, right? That applies to, when you wake up in the morning and you think about how your day is going to go, to every kind of interaction that you have. So I think we're all going to take that away as well. But we've covered a lot of ground, right? So we've talked about being a mom, we've talked about COVID, we've talked about, interpersonal relationships. What, of all the things, as we come to a close, what do you want to leave everybody who's watching us now and who's going to watch this later having in their mind as a part of this bigger picture of mental health? Like, what are your final words of wisdom for us?
I think my final word is resilience, in that resilience takes us going through things, pandemic, strained relationships, stress, life, and realizing that because we fall down once, it doesn't mean that it's the end. So really finding a way to be resilient, and that is to give grace in this moment, accept grace for yourself, and guard your mental health.
Yeah. Okay, I love that. Resilience is one of my favorite words. Now, the practical tip to go and do that is actually go and sign up. I know our link is above all of the comments. Go and sign up for the self-care download. It has really practical, simple things for your nutrition, your, physical wellness, and then some of these conversations around mental health and just kind of how we approach our world and how we think about taking care of ourselves so that we can do better in all the things that all of us want to do, whether that's with our family, our career, our ambition to do more for people in the community, whatever that means to you. Hopefully the self-care download and the being part of this community experience is a starting point for you. Of course, as you know, we have tons more coming, and I can't wait. We're going to be back here again for our final video in this 8-week video series. But as you guys all know, we are always doing new things, and we'll have a lot more really and very much focused on this theme of resilience, right? As we come out of 2020, I know our She is Fierce team is having a team retreat tomorrow, mostly socially distanced, a lot of people on Zoom, but we are going to be coming together to talk about how can we help women in our community come out of 2020 more resilient, right? And build in 2021, build that strength, build whatever their big dreams are that they've had to put on hold or had to kind of adapt and adjust. So keep an eye out is my my word of the day. Dr. Ampiah, I'm so grateful to you for your wisdom, for everything that you're doing in the community in the middle of a pandemic. It's a lot. And I just know that we're all grateful. And thank you to everybody who joined us live, or everyone who's watching this later. Feel free, you can always comment and tag She is Fierce, tag me. I know, Dr. Ampiah, you might be busy at work all day long, but you can tag Baptist for her, and we will make sure to get back to you. So if you're wondering about a resource, maybe one of the organizations that Dr. Ampiah mentioned, tag it, let us know, or send us a private comment if you need to, and we will do our best to help you. Okay? I hope you guys have a wonderful night. Thank you again, Dr. Ampiah.
Thank you so much for having me.
It's been a pleasure.